New research has revealed the unusual and potentially dangerous places people are going for health and nutritional advice. Almost 4 in 10 people would choose to go online to seek advice about their own health and well-being, and around 1 in 20 Brits would turn to social media sites like Facebook or Twitter for advice on health issues. Dietary consultant and lecturer Ben Brown outlines the dangers of this growing trend.
In terms of the reliability of health information, there are a number of different potential consequences. One of the more obvious ones is misdiagnosis. You might have something that seems like a garden variety headache, but it could be more serious. And the same is true for diet and nutrition information. We know most people are dieting at some point in their life, and it's important to get professional advice around that because you could be following something that's a bit potentially misguided and, unhealthy in the long term. And the same is true for natural products. We know that 55% of the population are using these on a regular basis. And the internet's a bit of a quagmire for natural products. It can be very easy to, pick something that's not necessarily, beneficial.
The growing number of Brits using supplements has led to 1 in 4 people relying on their local health store for advice.
People come into health food stores asking for wellbeing advice. It's like a cornerstone of what we're about. We have a whole range of products which are unique and that people won't find anywhere else. And it's important that they have information in hand to be able to advise them about those products. Personally myself, when I used to work in stores, if people came in and saw me earlier, they would have got resolution to whatever problem they had a lot quicker. Probably a good example of one is where I saw a woman who came in, she'd had eye twitches for a number of years, and it was really clear that she had magnesium deficiency. So I gave her that supplement, and then 2 weeks later she came in and it was resolved.
With the average wait time for a GP appointment set to tip 13 days by 2015, Brits may have to rely increasingly on alternative sources of health advice.
So for good, clear, credible health information, important concept to start is that you need to speak to real people and people that are well qualified. And your registered health professional is a really important first port of call. And if you're looking for general diet and lifestyle related advice, and in particular advice around natural products, much better to get off the internet and get into your local independent health food store and speak to someone there. They're often well qualified and certainly have a lot of experience around these kinds of things.